Hey, welcome back to TellSamyra. I'm talking about how to choose a therapist and what to expect on your first visit with the therapist. So, you can use your insurance if you have insurance to find a therapist. You can just contact the customer service. They'll let you know how many visits they cover. Some insurances are better than others. Some you can have unlimited sessions as long as you can prove that you actually need the services. And what they will call that is functional impairment, meaning that there's some type of trouble you're having in your day-to-day functioning. Maybe you're having relationship troubles, maybe you're having problems at work, you're really not motivated, so maybe you show up late or you don't show up at all, or there may be problems in your education. Maybe you're going to school but you're not turning in your assignments, you show up late. So there always needs to be a reason. If the insurance is paying for it, they're like, okay, why are we paying for your services? Do you really need these services? And so some insurance companies may decide to only give you a limited amount of sessions. So you always want to just check with the insurance to see what does it cover. Now, let's say maybe you don't want to go through your insurance or you don't have insurance. The beauty of today is that you can go look online. There's places like BetterHelp. There's places like, I believe it's Talkspace. You can do sign up with these places, and now some of these places are actually accepting insurance. So if you just want to go with a place online, you can do that. Give them your insurance, or you can pay out of pocket. Some places have sliding scale. So if you don't have insurance, you want to always ask about a sliding scale, because especially if you're low income these days, middle income, maybe you can't afford to pay for a full session, but that shouldn't stop you from getting services. So ask them, hey, do you offer a sliding scale? And they'll let you know what that is. And again, I think, as I said, some people also pay back by cash. Now, one thing is, back in the day, therapy, it was only that you can meet with people, your therapist, face to face. But today you don't have to do that, especially because of COVID. A lot of mental health therapists now are working from home. Like for myself, I work with two different agencies, but I'm full-time at home now. Before this, I was working at another place that I was working at home 2 days a week, and then I was at the office 2 days a week, and at home 3 days a week. So it really just depends on what you want. Of course, if you find some place like Talkspace, BetterHelp, it's going to be 100% online. But if you call your insurance, or if you find someone that's in private practice, you can do that, who accepts insurance or cash. Maybe they have face to face if you like it. Me as a therapist, I don't really have a preference. I know people, when it was new, therapists, they would say, oh, I really don't like doing online. It's not the same. You really can't gauge your person's reaction to what you're saying and emotions. I think it's just fine. I like doing it because, one, it's convenient for me. Two, it's convenient for clients. Like, we use what is it, the agencies that I use, they use Zoom, some kind of, to try to keep everything private. And it works for us. I don't have clients with their family and friends and boyfriends, girlfriends coming in and interrupting. People are at a safe space, or they're in a car somewhere parked on the side of on the road, and we're getting it in, as long as they're not driving. Because it would be so embarrassing, like if somebody was driving, I was doing therapy, and they fell off the road, and I'm on the phone. Yeah, I was on the client with, I'm calling the police. I was on the phone with my client, they fell off the road. Really don't know what road, can't tell you any information. I can just tell you their name, what the city they live in, but who knows that they was in that city and they flew off the road. God forbid. But you get my point. So yeah. So that's how you choose a therapist. You can also have your own preferences for a therapist. Now, this is new to me. I didn't know that you can call into an agency and request a therapist based on race. So don't y'all feel bad about it. It does not make you a racist. It just makes you whatever. Maybe you just want someone who looks like you. You assume that person has the same background as you because they're the same race, which isn't always the case. It does not mean that you're going to have a good relationship, good rapport with the person because they're your race. But if you believe that's the case, You have a right as somebody who's paying for services, even if your insurance is paying, somebody paying for that service. You have a right, and I don't believe I did that. Y'all gotta excuse me, but anyway, my and I'm not about to edit that out, but my tripod, whatever it's called, is broke, so I'm doing the best I can, honey. I got this little phone set up on my little computer box that it came with, so we gonna try to work it out till I get a new tripod. Anyway, so yes, so you can request even gender. Maybe you want a gender the same or different from you. You can ask that. Don't be shy. Uh, what else? Religion. Maybe you want someone that's spiritual. Maybe someone that's Buddhist, someone that's Christian, someone that's atheist. You can always ask. The only thing they can tell you is that they have someone like that at this time, or no, they don't. Or if they will get someone like that, they'll give you a call if you want to be put on a waiting list. Also, if you LGBTQ, you can ask for that. You can also ask for specialties, meaning does your therapist specialize in what you need help with? For instance, you may need help with addictions, but your therapist may not have any experience in addictions. You may need help with anxiety, depression, or you may have childhood trauma. Does your therapist have experience in these things? You should be able to ask these questions. Also, you may have certain interventions that you like. For instance, like cognitive behavior therapy, CBT. Some people like psychodynamic, psychoanalytic, problem solution focus. Some people may not even have any idea what I'm talking about right now, but even so, you can request these things. And some sites, especially if will have your therapist information on their website, but some don't. I prefer that they do. That way you can see a picture of your therapist. Of course, it's not going to give you all you need to know about your therapist, but at least you know what you're getting into. Because therapy can be scary. You don't know this person, and you're about to tell this person all your hopes, dreams, and your nightmares and trauma. At least you can go in knowing what the face is going to look like on the other side. At least I think that would be helpful. So some sites they have, so like I said, the picture of the therapist, what they specialize in, and will allow the client to choose their own therapist. So you go, like, it's like a dating app almost. You scroll down, see, does this person meet my needs? Does this one meet my needs? Okay, I'll go with this. And that's totally fine. Now, some agencies, they don't care. They may have a lot of interns, associates, and you may call for a therapist, and they may just tell you to show up. Your therapist is Samyra, and you will see this person on this date and time that you agreed on. You will go in knowing nothing about that therapist, because there's no website. And then if you don't know that you can ask questions about your therapist or give you what you would like from a therapist, you have no idea. You just show up, and your therapist just has whatever information you might have filled out online. So now get into that part. As a therapist, if somebody let me say this to y'all, please, and please listen. If a therapist sends you paperwork, it's just like going to any doctor. Please fill it out. Please don't come to that session saying, I thought we could just talk about it here. Because usually those people who come in talking about, I just thought we can talk about it here, it's like pulling teeth trying to get the answers to the questions. Some of the questions, it can be very tedious to do it in session, and some people don't come back because depending on the agency you go to, some agencies make you do a lot of paperwork for the new assessment. So you may have to fill out information about your background, like was there a history of trauma? Have you had therapy before? What was your satisfaction? Why did you go? Have you had psychiatric hospitalizations? Do you have any medical issues? What type of medications are you taking? How did you grow up? Where do you work? What type of business do you do? What type of symptoms are you having? Like, why are you coming in? Is it anxiety? Is it depression? Is it stress? Is it a life transition? You're changing jobs? Were you laid off? Were you divorced? Couples issues? What's going on? So just like you might want to know something about your therapist, we want to know something about you. It is frustrating to have someone come in and it's like, I have no idea why they're there. And then if I ask you to fill this stuff out before you come, usually it's like, do you have panic attacks? Strongly agree. don't disagree, strongly disagree. So then it's like 40 something questions that some companies want you to fill out. So I don't want to sit there for 40 questions. Okay, are you sad most of the day, some of the day, just 1 or 2 days, not at all? And okay, are you let's see, having sleep problems every day, 5 days, 4 days, 3? And that makes me frustrated. I'm sure it makes you frustrated because you don't really get to have a relationship with me. You know nothing about me. All you know is this woman is asking me all these dumb questions with all this stuff. But if you would have answered some of the stuff when we sent it to you at home, it would have made it a little bit easier. Now, of course, your therapist is still going to ask you some deeper questions about the things you filled out, but at least it would work better. I had to get my agency where I was working before. I told them, if people don't fill out the paperwork, tell them I'm not available. Because some people weren't coming back to their second appointment. They were complaining, oh, it was so tedious asking all them questions. But okay, and at the time the agency wasn't requiring people to fill it out. So once we started having them fill it out before they got there, it was easier, more like a conversation and less robotic. Strongly disagree, somewhat disagree, majorly disagree. You know, we could actually have a talk. What brings you in today? What are you hoping to get out of this session? How would our time together best serve you? How would you know when it's time to end therapy altogether? What would be different in your life? A connection, some genuineness. So once that started happening, people were filling stuff out beforehand. Then the retention rate of people coming back for the second session was available. Fill out your paperwork. Okay. And so once you do that, some agencies will have you the same appointment or the following appointment is to come up with your goal for therapy. Why do you want to come up with a goal for therapy? So you know what you're both working on. Is what you two are doing, or maybe you're in couples or family therapy. You can also do that. Yeah, if you, let's say you're in therapy and you want to know, why are you there? Is this working? So for instance, if someone's coming in for anxiety, maybe they have chest pains, sleep trouble, difficulty breathing, irritability 7 days a week. Maybe the goal would be to reduce anxiety from 7 days a week to 5 days a week. And after some sessions, I don't know, 12 sessions, 3 to 6 months or whatever, maybe if they get to the goal of 4 days a week, the goal would be the new goal to reduce anxiety from 4 days a week to 2. We're not going to go down to 0 days because people are human. There are going to be times where you're anxious. There are going to be times where you are sad. But again, one thing, just to go back a little bit about the types of therapy. So yeah, you can request, if you wanted, individual therapy, just means just you and your therapist, or couples therapy. Couples therapy is you and your partner. You can be married, you can be heterosexual, LGBTQ, you can just be boyfriend, girlfriend, relationship, whatever. You can do that. But you also want to see, and this is just my suggestion, does your therapist have experience with couples therapy? Because not all therapists have experience with couples therapy. Some therapists won't even see couples because it can be difficult. You want to ask if you want to bring your whole family for family therapy, which could be beneficial if it's a lot of stress going on in your family, because sometimes we try to pick out one person like the scapegoat. This is the problem child, this is the problem dad, the problem mom. But it may be something that's going on with the whole system of your family, that if you all get help, it could change what's going on at home for you all. So does your therapist have experience with families? Does your therapist even like working with therapists? So these are all things that you can do. And remember, you are paying for these services, and even if you're not, somebody's paying for them. But if you have that insurance card, or you're paying by cash, whether you're seeing someone at an agency, someone for private practice, someone you met online, you have a right to ask questions of your therapist. And with that being said, I just want to let you know my email is going to be in the description below. TellSamyra123@gmail. Again, TellSamyra123@gmail. If you reside in California and you have insurance and you would like to meet with me, go ahead and send me an email and I will reply back and let you know what type of insurance that I accept where I work. And then we can try to get something going where you can see me with your insurance through the agency where I work. Or if you don't have insurance, you can go ahead and look down below in the description and you will see through VisaBook, you can go ahead and schedule an appointment with me, and that information is there. But if you're not in California, it will just be considered like a coaching session. Coaching, we may not go real deep into anything, but I was just giving you some tools to allow you to vent about what's going on, come up with some coping strategies for you. It won't really be anything long term because I am licensed in California, so it would just be like a coaching more about narcissistic things and things you saw off my channel, just to talk with you. But like I said, if you're in California, you can feel free to reach out and we can work together for therapy. So let me know your thoughts below. What was it like in your first session? What did you like about it? What did you not like about it? And any tips that I didn't say that you think is good for your choosing a therapist. And one last tip, now that I think about it, is that CBT, cognitive behavior therapy, is really big these days. So a lot of people like to call in, do your therapist practice cognitive behavior therapy? And there is a lot of evidence-based work that shows the effectiveness of it, but that does not mean that other forms of therapy don't work. But you can have someone who does the best cognitive behavior therapy or any type of therapy, but if you don't feel a connection with that person, it's not going to be a good fit. You have to feel genuineness with your therapist, that this person is actually listening to you, actually cares about what you say, actually cares about you, and that you feel that you're getting something out of the session. That's what I try to gauge things on. Is there a reduction in symptoms? And what is my client getting out of the session? I'll often even ask my clients, what are your takeaways from today? What stood out to you? Is there anything that I did not get right today that you want to clear up for me? What is your satisfaction with today's session? And I ask this to see if we're on the same page. And you should be able to have these conversations with your therapist. If you don't feel a connection with your therapist, it's okay to change therapists. Now, what I would suggest is give it a few sessions. Don't go to the assessment and think, oh, they asked me so many questions, it's going to be like this every week. No, it's part of the assessment. They have to do a thorough job of asking you various questions about your life, present, and past. So it will be more tailored to your personal needs, the future sessions. But I would say after like 5 sessions or so, you don't feel you're getting anything from these sessions, and you do have to be realistic. It's like you can't be negative 25, 30, 50 years and think this therapist has a magic wand and is God and is going to cure you overnight. If you're not willing to do anything different, there's not going to be any changes. Your therapist isn't all-knowing. That you have to talk, you have to open up, you have to risk the pain of sharing whatever it is that brings you there. You have to be truthful, authentic, because if you're not those things, it's not going to really do you or your therapist any good. And if you don't apply any suggestions the therapist give, it's not the therapist's job to tell you what to do, but at least to maybe give you some skills on, maybe, have you thought about doing this? Have you thought about looking at it this way? Have you thought about increasing your activities? If you just want to do what you've been doing before you came to your therapist, nothing's going to change. So don't blame your therapist if you're not willing to put that work in. So it's more like a collaborative work. It's not just what your therapist can do for you and have all the cures and know what's best for you. It's for you to show up and you to learn some new tools and go away and practice them outside of session, and to come back to let the therapist know if it's working or if it's not working. So again, I'd love to hear from you. Thank you.